So homeopathy, aka bringing your dog back from the dead since last semester. So here in this auditorium, I've got a bunch of pharmacy students with me, 3 years worth, and we are going to be entering our professional lives wondering how we can help patients that have questions about homeopathy. But in the course of preparing this presentation, I found out that not all of us know what homeopathy is. It sounds natural, it sounds safe, there's all these ideas that people have when they first hear the word. So we're going to talk about it a little bit. Whoa, don't look at that one. Remember the good old days when doctors would kill you? Remember when you didn't want to go to the doctor because your next step after the doctor was the morgue? Or if you went to a physician, you'd tell him something like, I'm feeling a little sad. They would reach into their pocket, pull out a sharp piece of metal, and start looking for your veins. Right? Bloodletting, for example. They would do it for any number of indications. It's been going on since the time of the ancient Egyptians, ancient Greece. And if you still had some blood left, and you had a bad case of hemorrhoids, you would get some surgery. That was your mainline treatment. So how would you tell the difference between if you were being tortured by that gentleman with the hot iron poker, or if he was actually trying to give you a medical intervention? Well, the answer is, if you had hemorrhoids before you went to see him, he was a doctor. So is there any wonder in your mind why there might be some insecurity when people think about medicine, doctors, that sort of thing? And if the surgery didn't kill you, the anesthetic probably would. This is a recipe that was very common in medieval times. There's like 7 or 8 different specific recipes for it in England. It's called Dwale. It had 2 types of ingredients, the harmless and ineffectual, unless you're like my son and don't like lettuce, and also the potent and dangerous. So they would put you under. The guy with the hot poker would be working it in the coals. They'd hand you your mug of Dwale, and you would drink it until you pass out. They're not hazing you, they're just trying to help. So, okay, this is time for some audience participation. When you think of pharmaceuticals, now I'm kind of leading the question. We've got this lady with the horns, but when we think of pharmaceuticals, we think of something different because we're all student pharmacists. But what do you think the average person thinks when they hear pharmaceuticals? Got any ideas? Big pharma? Have you seen this? Okay, that's good. What else? What else with pharmaceuticals? Now, I know you've seen it. There's side effects. It's expensive. It could be dangerous. They're biased. Now, this biased is from a scientific survey of med students, and they were asked their opinion on pharmaceutical industry, and over 75% of medical students thought that the pharmacy and pharmaceutical science, pharmaceutical industry was inherently biased. So now we go to homeopathy, right? You may think of homeopathy now as a dapper older gentleman who makes $3 million a year bringing sheep and dogs back to life, right? But when most people think of homeopathy, what do they think of? Anybody? Any suggestions? You can shout it out. Natural medicine, right? It's you've seen the slideshow. Useless. No, safe, effective, natural, very good. Anything else? Gentle. It works with your body. It's an alternative, right? So all of these above adjectives were provided to us courtesy of the National Center for Homeopathy. And a lot of, that's stuck, right? So a lot of consumers, when they think of homeopathy, they think it is a treatment that you get that isn't a hot iron in your rear end, that is safe, gentle, and natural, right? So let's talk about the history of homeopathy. This gentleman is Samuel Hahnemann. He is Hilfer der Menschheit, the helper of mankind, child prodigy. By the age of 12, he was teaching his language instructor how to speak Greek. He's German. He spoke 5 languages. By all accounts, he was Isaac Newton level for his time. He studied medicine at Vienna and Leipzig. He transferred out his final semester so he could save money to get his degree, but that's a story for another time. And he did a dissertation on cramps, he got his degree, and then he dedicated his life to practicing medicine. But the entire time, he was unhappy with the profession. One of the reasons he was unhappy is because they were constantly trying to take people's blood, right? Not exactly vampires, because most of the time they did it during the day. And so, according to one of his biographers, he would work in medicine as a doctor to obtain proofs against the way traditional medicine, or modern medicine, as they called it back then, was done. He translated this book, and when he translated it, he saw a remedy that intrigued him. So cinchona, Dr. Linger talked to us about this in her medicinal chemistry class. Back in the day, we didn't know what caused malaria, right? As a matter of fact, does anybody know what malaria means, the word itself? Bad air, right? They thought you could walk into an auditorium like this, and if there was a pocket of bad air, you could get malaria. Well, we know it's caused by a parasite. Hahnemann didn't. So he took a small dose of this remedy, and he saw that it produced in himself the same symptoms that you would get if you had malaria. And he had what's described by his biographers as a eureka moment. He's like, wait a second. This thing cures it, and it also causes it, right? So that's the first principle of homeopathic medicine. Like cures like. Cinchona bark gives us quinine. Substituted quinolones. We know how it works. It interferes with the parasite's metabolism and kills them from the inside, right? But he got stuck. This guy recruited his entire family to figure out how, if a large dose gave you the ailment, how can the small dose cure you of it? So, according to his biographers, day after day, he would scour the hinterlands looking for herbs, try them out. Sometimes he'd faint. He just found a cure for fainting. Sometimes he'd get a fever. He just found a cure for the fever. Sometimes he would vomit. Homeopathic cure for vomiting. And he got his entire family together to help him with the endeavor. So this is a figure that's from our over-the-counter medications book, and you've probably seen it. And it brings us to the second principle of homeopathy, and that is that the potency of the medication increases with dilution, right? So we've got a substance that's going to cause a symptom in you, but if you dilute it enough, by some miracle of modern science, it goes from causing symptoms to curing them. And there's a particular way that people do this. It's not, you can't just dilute it, but there's almost like a ritual to how you shake it, right? And then for the C, it's diluted 1/100th. For D or X, it's diluted 1 in 10. And if you see a number, like a homeopathic dose is a number or two numbers followed by a letter. So 30C, it's been diluted 1/100th 30 times. So it's kind of hard to imagine. So I tried to put together a way to illustrate it in this auditorium right now. Does anybody feel nauseous? No? Good. And here's why. This auditorium is 72 feet by 60 feet, maybe 30 feet I'm including. I crunched the numbers, and that is 3.669 times 10 to the 9th milliliters of air in this auditorium. I'm breathing some of it right now. Your average flatus over the course of a healthy morning is 400 milliliters. Is there anyone in the audience brave enough to admit that they've emitted 400 mils of flatus right now? We've got one. We have a winner. So what does that mean? That means that his mils of poot have expanded to fill the room, right? It's not an ideal gas law, but it does follow those same physics. And we are at a 4C dilution of homeopathic nausea remedy. Now, if you had just squeezed out a tiny one, we would be at the most potent nausea remedy that homeopathic medicine can give us, a 30C. Does anybody have any questions about the fart in a hallway analogy for homeopathic? No, you get it? Okay. Does homeopathic medicine work? Well, I've illustrated to you that it indeed does. No one admitted to being nauseous. We all admitted to, he smelt it, obviously dealt it. It does work. It actually works. The guy with the bow tie that brought his dog back to life last semester was experiencing an effect of a homeopathic remedy, and that is the placebo effect. To the extent that placebos work, homeopathic remedies work as well. This has been in dispute by the National Institute of Health. We've got the Center for Complementary and Alternative Medicine. It is their mission to look into the effectiveness of this remedy. And homeopathy has not been definitively proven to treat any clinical condition. There should be a ... Any clinical condition better than a placebo. If you've got something that can be fixed by a placebo, homeopathic medicine is going to help you fix it. So let's get some more evidence here. When homeopathic remedies are tested in clinical trials, when people are blind as to whether they're getting the remedy or not, whether they're getting the homeopathic placebo or the regular placebo, they do not work. They are no better than placebo. And I'll link to this specific study. You can find those in the works cited, and I'll have it in the box down below and also at the end of this slide set. So what do we do now? We've got a couple hundred pharmacists here in this room, and we were in this room when they gave us somebody else's inappropriately sized white coat for the first time. You guys remember that? If you happen to get the right one later, you might remember your oath when you said, "I promise to devote myself to a lifetime of service to others through the profession of pharmacy. In fulfilling this vow, I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients." So with the skeptical eyes of George Copenhaver, we are going to examine some real-life homeopathic evidence. Cold-Eeze, has anyone ever seen it? This is technically a homeopathic remedy, but it's an unusual remedy because unlike most homeopathic preparations, this one actually has an active ingredient, zinc. And if you read the box and believe what you read, you will no doubt realize that it is clinically proven to reduce the common cold. Congratulations. It's also the #1 pharmacist recommended zinc treatment, and it's $6. What a deal. So we have got a poor tugboat captain who does not feel good, right? And he brings this remedy, sorry, Aaron. He brings this remedy to your counter. You've got some questions to ask him. Why is he bringing it to you? Now, this is just basic pharmacy practice, right? What are your symptoms? Do you have a sore throat, runny nose, cough? Do you have exclusions for self-care? Are there any other questions that maybe we should ask this guy that you can think of? What makes it better? What makes it worse? What have you tried already? All good questions. We've already talked about the symptoms, but what we need to talk about with a homeopathic remedy is what are the exclusions for self-care? What can taking this medication hide or make worse? Does he have a high fever, chest pain? The SOB actually in this case means shortness of breath. Has his cough lasted more than 7 days? We are not trained to diagnose and treat, but we are trained to help people help themselves, and we are trained to help them avoid mistakes of ineffective homeopathic remedies. Now, like I said earlier, most homeopathic remedies don't have an active ingredient. This one does because it's only 2x, right? They took a lozenge-sized sample of zinc. They took out 1/10 of it, diluted it in 9-part solvent, took out 1/10 of that, diluted it in 9-part solvent. So every lozenge has 13.3 milligrams. So now we're dealing with a whole nother animal. This is actually like a real drug at this point. And I'm sorry for all the homeopathic cheerleaders that are watching this video later. It's like a real drug. The box has told us that this is going to reduce the duration of our cold by half. Let's look at the evidence. So here's a DLE lit review. There are 13 placebo-controlled trials for this particular formulation. They used some other forms of zinc, and they found that if you had a dose of less than 75 milligrams a day, it's not going to work for you. If you manage to get over that amount, it might help, depending on the salt, this one's gluconate, so it 20% reduction in symptoms. So let's do a little bit more math. I know math is your favorite subject. I wanted to be an astronaut. Here I am instead. 6 lozenges a day, unless you're under 18. Each one has 13.3 milligrams. We made it over the threshold. But you can only have one every 2 hours according to the directions. So is it worth it to you to take this homeopathic remedy? You will be sucking for 12 hours to get a 20% reduction in symptoms. So personally, I take the zinc. I don't follow the directions. Sometimes I'll have 3 and 4 of those in my mouth at the same time. When I come to, my throat is perfect, right? But for your patient, what are you going to do? Would you guys recommend this particular homeopathic remedy? Yes? No? No. Well, it could work, but they really have to suck on these things all day long to get an improvement. So let's take a look at the next one. With the skeptical eyes of David Wong, we are going to examine the next product. This is a true homeopathic remedy. This has been diluted beyond all sanity. And each one of these pills contains, statistically speaking, not one molecule of St. John's wort. You are literally breathing in more fart molecules at this moment than whoever buys this is going to take in of the St. John's wort, or as homeopaths call it, the Hypericum perforatum, right? 30X, supposed to heal bruises, supposed to fix itches. It is supposed to help your tailbone, a real deal at $13.87. You can buy it at Walmart. Felix is in trouble here, and he comes to the counter with some injuries, right? Especially at the base of his spine and his fingertips, hopefully separate injuries. Nerve pain, dental pain. What questions are you going to ask him? Again, what medications? Anybody else? Questions for Felix? How long has he been experiencing the symptoms? Does he have any exclusions for self-care? And this is where it gets tricky, because with this specifically, tooth pain or nerve pain for an extended period of time, it could be masking an underlying symptom, right? Or an underlying problem that if it's not treated properly could cause serious harm to the patient. And I've listed a few. You can find those in your OTC book, and I've got the reference linked in the box below. So now this is interesting. This study was actually published in a reputable homeopathic journal. This is peer-reviewed by people who believe in the power of homeopathy. And their level of evidence was unclear. So one of the problems with this type of remedy is you're thinking like a pharmacist, you're not thinking like a magician. So when Felix brings this up to you, right, you're gonna think, okay, St. John's wort, right? It says St. John's wort on the box. Are there drug interactions? We're not concerned whether Felix is pregnant or not, but pregnancy is an issue here, right? Do you need sunscreen? But you don't need to think that way with this product because it literally has none of the active ingredient in it. And in that same homeopathic journal, these are the guys who are invested in making this stuff work. With this meta-analysis, they found an effect. And in the same sentence, they said it was not statistically significant. So let me translate that for you. What that means is, we accidentally found some people that got this to work. They probably would have gotten better anyway. And their conclusion here was, case reports suggest therapeutic potential for pain management, but this effect is not supported, right? So would you guys recommend this particular remedy? Yes? No? Sorry. So Tonka, with his skeptical eyes, is going to help us examine the next one. I think this one's yours, Katie. This is a different class of homeopathic remedy, maybe?
Okay. Well, we can see I've chosen a product, and it's called, go ahead and, Zim's Crack Cream. Now I want you to put yourself in the position of a consumer instead of a pharmacist for right now. You see this product on your shelf. It says Zim's Crack Cream. You have your baby with you, and it might have dry skin, or you might have dry skin from washing all the dishes. So it was produced actually by a pharmacist in Austintown, Ohio, and he noticed that all his concrete workers that came in had dry hands, rough hands, so he formulated this product and put it on the market. Its active ingredients, I want you to take a good look at them. We've got glycerin, SD alcohol, we might not even know what that means yet, miracle oil, and a homeopathic-ish ingredient that stuck in our head from last semester was Arnica montana extract. Now I'm kind of going to ask you guys, do you think that this is a homeopathic product? Raise your hands if you think it's a homeopathic product. We got a couple. So go ahead and forward slide. We got ingredients, glycerin, just the emollient, it's the moisturizer. SD alcohol prevents it from foaming. It also is stringent purposes, but pretty much it's a thinner too. Miracle oil, just an anti-inflammatory, and you might see this in studies called bayberry as well. But the Arnica montana extract that we so heard about last semester, it doesn't have a specified quantity, so it doesn't have the 2 numbers, it doesn't have an X or a C. But its purpose in this product is just a skin conditioner, and it adds fragrance. So now, does that change our views about the homeopathic-ish ingredient? So many patients will come up to your counter, now you're in the pharmacist role. They're going to ask you, is this going to actually help me? Is this going to help my baby's diaper rash? And we've got to come up with a conclusion with our professional opinion by using our knowledge. And that knowledge we got from an OTC book that's green. And some of the exclusions for this product would be under 2 years of age. Maybe you have a bad infection and you don't know about it under your skin. So we want to recommend these patients to a dermatologist and not just dismiss some of their conditions. So what's the risk to benefit? What's the harm of using this? It's pretty expensive. It's $7 or $8 a thing. If you get it cheap, it's $6. It's not a miracle cure. If you have really bad skin or if you have really dry skin, it could be a number of factors. It could be eczema or psoriasis. So we really want to be careful and tell our patients they need to see a dermatologist for their skin conditions. And so people that are seeking these products, the homeopathic ingredients, are in a different mindset. They might not like doctors. They might not think that they want a medicine. They want a natural homeopathic ingredient. So this product will help you. If you have only mild to moderately dry skin, you want to make sure you go to the doctor if anything more. Would you guys recommend this product? No. only for mild dry skin. And so that's why I'm going to turn it back over to Josh. Thank you, Josh.
One of the things that Katie was talking about, and it's kind of important to think of when we're dealing with a patient that's interested in homeopathy, is they're a target for this type of advertising. They are interested, like Katie was saying, in natural products. They don't want medicine. They don't want to be dosed up. And we, as pharmacists, have the ability to really make sure we put them in the direction of a product that's actually effective, that actually has an ingredient that is going to work. And it brings me to the ethics here, right? So I've always thought to myself that I want a doctor who's going to give me a placebo, right? If I can be cured with a placebo, give me the placebo because the side effects probably aren't that bad and it'll make me feel better. But can you trust somebody like that? Homeopathy is good only in as far as it mimics the placebo effect, right? So would it be ethical to recommend a placebo to your patient? Did anybody here, you don't have to raise your hand or admit to it, but when you were younger, under 21, did you have somebody give you 5 or 6, 7, 8 non-alcoholic beers? And you didn't know they were non-alcoholic beers, right? So at the end of the night, you learned a lot of things about yourself. You got some bravery. Maybe you asked her out to the prom. She said no. And as you're getting ready to stumble to your car, your buddies show you the bottle, and it's non-alcoholic beer. No one has ever sobered up more quickly. And that's what happens with our patients when we recommend products that are, in essence, no better than a placebo, right? Eventually, the truth's going to get out there, right? We can't all have our dog resurrected through the power of magic, right? These guys are going to find out that we're costing them $7, $8, $9, $12, $15, $200. So they can have the placebo effect. And are they going to trust us? Well, I don't take beers from Rob anymore. One other thing about the ethics that I wanted to talk about was there could be delays in treatment. It's very important that when somebody comes and we would feel comfortable letting them take a homeopathic remedy, that we are confident their condition's self-limiting. We're confident that it's not going to cause harm later. Now, this is a big one, and the individual who gave us our previous homeopathy convocation started by saying, you don't need to take the flu vaccine. Take the homeopathic vaccine. It works with your body. Now, I'm going to read directly from the description on this website. Influenzinium is a homeopathic flu remedy that is updated each year based on the flu strains predicted by the World Health Association. It is homeopathically diluted and potentized to stimulate your body's own defense system and arm your immune system against the current flu viruses. It does not suppress symptoms, but naturally strengthens your immune system. Take 3 pellets once a week during the winter months. This for this one, right, this year, to prevent the flu. This product does nothing. It absolutely does not do anything. Your level of flu protection would be higher if you came in here and smelled that gentleman's gas rather than take this. Because one of the problems you have when you take this remedy is that now you think you're protected, right? So when Cody sits behind you in therapy and he's juicing you with all these flu droplets, you don't have to worry about it because you took the remedy, right? I'm sorry, Cody. This year, as of January 31st, according to the CDC, has been one of the worst flu seasons for people at high risk over the age of 65. There are more hospitalizations than since they've recorded. And if we did not stand in the way of somebody's grandpa getting this influenzinium and then going to the hospital, we probably failed our oath as a pharmacist. Every year that these influenzinium flu remedies come out, the FTC and the FDA send warning letters to the manufacturers telling them to cease and desist advertising in this manner. And they do. And flu season's over. And next year, they're back with their World Health Association updated, brand new flu vaccine, which is nothing more than sugar water. I'm going to quote Steve Novella. He's the founder of the Society for Science-Based Medicine nationally. Homeopathy is based on magical thinking. It does not have even the barest toehold in science or reality. In spite of this, it's been extensively researched for its clinical effects. While most of this research is of poor quality, there is some reasonably high-quality research which consistently shows that homeopathy does not work. Our previous convention or convocation speaker had a website where he did all his business, and the name of it is Homeopathy Works. No, it doesn't. Any questions? All right, we're good. Thanks, guys.